Hi, my name is Jose Vinanzaca, and I am a recovery support specialist working for the Mobile Crisis Response Team. A recovery support specialist is an individual who has lived experience with a mental health condition and who utilizes that lived experience to support others navigating the mental health field. So I live with bipolar, and I've been hospitalized several different times, and those experiences have provided a lot of insight as to some of the different resources and support that exists for some of the varying levels of recovery, and how one can orient themselves to building some of those support networks or tools for themselves. I think at times we may not know how we look like when we are doing well, and sometimes we may not know what are some of the elements that trigger us. And sometimes we may not know how we look like in crisis. And so an action strategy for prevention and recovery can help us to better gain awareness as to what we look like when it is that we're not doing well, as well as how we can take some of the steps to support ourselves. And also share that with some of our support team so that they are also aware as to what may be helpful in the varying levels of crisis that can come about. There would be groups that I would have at times in settings where people found it very relieving to have someone who was speaking about having experiences of having hallucinations or even a hospitalization. It really tore down the walls of just the permanency that sometimes a stay out of mental health can bring over someone who's experiencing a mental health challenge. And I think when it comes to the success stories of mental health, we are often bombarded with some of the negative stereotypes of what are some of the not so good situations that can happen. But I think having positive, successful stories helps us to rewrite some of the ways in which these stereotypes befall onto some of the mental health conditions that exist.